Well, good Monday morning to you, and welcome to another Monday morning live edition of Healthy Living South Mississippi. Live healthy, be healthy with doctors Jim and Janine Fox.
Hello.
We have Doctors Nutrition located on Cowan Road in Gulfport, south of Pass Road. Of course, this is a live show, so we invite you to call in about this morning's topic. Or if you have a question about something else, maybe you didn't get to call in last week, you're more than welcome to call in and ask that. If you don't want to talk to them personally, you can just leave a message with our operator and they'll pass on the question to us. The phone numbers are 896-0713 or 800-349-0713. Last week, our topic centered around women. And today, guys, we do not escape. So,
That's it.
So I mean, it's an issue that
And guys are shy about calling, so if you have a question, just call and ask the operator. You don't have to be on. You don't have to use your real name even. You know, just call, and if you have a question, ask it. Because we really, when we have men's topics, we really do have less phone calls.
We're shy.
well, we have a little bit of pride in ourselves. You know, it's like we don't want to admit it that we have an issue. You
It's
know,
a guy thing.
we're
Yeah.
tough. Yeah, exactly. It's a guy thing, and we don't want to. But you know, I don't know. It seems like, but women live longer on the average than guys do.
They do.
Because
average, yeah.
on the average, they live longer than guys. So I mean, it would behoove us to try to do whatever we can to kind of bring that little space to a little bit closer together.
It has gotten a little closer. They have actually found some of the heart disease is increasing in women.
Yeah.
So it is making men get closer in average lifespan to men. I mean, so men and women are getting a lot closer. Isn't that what the latest
that's
statistics
what
show?
the statistics are showing.
Yeah.
Female.
Well, we're not talking about hearts today.
No,
We're
we're not
actually
talking
talking about prostate problems.
Yes.
And you know, an issue that I guess comes more with age than
Yeah,
anything.
It does.
As we age, as guys age, if you live long enough, so to speak, you're going to have some issues with it. Usually around 50 or above. And we're seeing it even younger now, in the 40s and so on.
And it can be any age.
It can be any age, but
It really
typically
can be
we
any
start
age.
seeing most of it front in the 40s probably. But we're starting to see these, you know, that what's called the BPH, with a benign hypertrophy of the prostate. And it start having that difficulty with the stream, getting up multiple times at night, going to the tinkle, you know, and things like that. So those are the issues that guys tend to have with that. And you know, there's a lot of different reasons for it, and I think maybe we want to talk about some of those reasons this morning, because that's.
I think the statistics show that at least 50% of all men will have a problem in their lifetime.
Yeah.
At least.
So at least, I mean, I think
Probably
it's probably
higher.
even a little higher with as many men as we talk to, but that's what they say on statistics, at least 50%.
At least.
So we're talking to a lot of men out there because this is actually a common problem, which is why we wanted to do a show on it. Because it is something that a lot of times people don't want to talk about or don't want to ask questions about. But there are things that you can do for that, and there are some causes. You were going to talk about some of the causes, and the biggest cause is probably age and
Well, you know,
hormonal change.
as we mature,
Yes.
hate that A word, but as we mature,
It's a guy thing.
it's a guy thing. You know, the hormones change. You know, and one of the things that changes is our testosterone. A lot more of it becomes bound, or what we call dihydrotestosterone. And you know, yeah, the DHT or dihydrotestosterone causes a lot of issues. One issue, hair loss. Won't mention anything, but the guy next door here, yeah, he's got this thing. Anyhow, I mean that can be part of it. You know, the DHT can cause that, but it also can cause things like the swelling of the prostate. And there's so many things that cause the increase in DHT, especially now. You know, we live in a really toxic environment, and I think that's probably one of the chief problems that we see is things like the increased use of plastics, you know, and the phthalates that come from those plastics cause a lot of issues with the prostate. So we'll talk a little bit more about that. Looks like we got Pam on the phone.
Yeah, Pam from Gulfport's on the phone with a call right now. Good morning, Pam. You have a question for the doctors?
Good morning. How
Good morning.
are you doing?
Good. How are you?
I'm doing fine.
Good.
I was diagnosed with fibromyalgia in 1996.
Okay.
I've had several different types of treatments. I've had acupuncture. I've had steroid shots. I've been on different type of medications. And I'm trying to find something that naturally I could do, like maybe vitamins. I've used the BioFreeze. It worked for a while, and then that didn't work. And I am a senior citizen. I like to stay active, and I know moving around helps some.
Definitely.
But the past year, it has gotten more intense, and it's working, you know, in my shoulders, in my neck, and up in my head. And I'm having a very difficult time sleeping. And I don't know if the fibromyalgia is moving further up, or if there's something else going on, like in the back, you know, where the stem.
It could be actually as you age. There's no doubt arthritis gets worse, and that will worsen fibromyalgia. It probably kind of goes together, and we see a lot of people with fibromyalgia. And there are a lot of things that you can do to help, but first you got to make sure there's no underlying problem going on. So we definitely always recommend for fibromyalgia patients to do lab work and make sure the vitamin D status is perfect, your thyroid status is perfect, the adrenal status, you got to get all your things like that working to actually help.
See, I've had that checked.
Well, bring it in.
Bring it in.
Bring it in, because most people have not had their adrenals checked. Even if they think they've had everything checked, a lot of times they haven't. So bring it in, we'll look and see what you've had done, and we'll see where to go from there. But definitely something that worsens with age is the arthritis, and that can get into the neck area. And there are other things, anti-inflammatories, that you might could do to actually help that symptom.
And there's a lot of things that can cause
Okay,
this.
and then I have a second question for you.
Okay.
I have a son that has 2 different types of arthritis,
Okay.
which was inherited on his father's side.
Okay.
One is called a pandromic rheumatistic arthritis,
Okay.
and then he has rheumatoid arthritis.
Okay.
And he also, last year, we had a lot of family issues, and he had to basically take care of it, and he had a nervous breakdown, and we think he had a mini stroke, and he doesn't have any insurance, and he's not able to work, and he's been trying to get on disability, but he really doesn't want to. He just wants medical help so he can go back to work. His hands have been getting numb and pain up to his elbow. Now, he is on the computer quite a bit. Is there any tests that can be run to see maybe possibly what's going on with the numbness in his hands?
There's some of the inflammation markers you would definitely want to check, like a SED rate and maybe even a C-reactive protein, some of those to see how much inflammation is going on in the body. And there's no doubt you mentioned that he had stress, and stress aggravates autoimmune problems, which is one of the things he has. There's no doubt stress makes it worse. Even any type of arthritis, you talk to people, and if they have a stressful event, their arthritis just flares. So the stress that he had could have flared up even that, and you don't know for sure. And even he could go to a neurologist, but it is expensive. And I know you say you don't have insurance, because some of the testing to make sure the nerves itself are not damaged is probably one of the things that he might can have checked. But we could do lab work. We do it very inexpensive because we don't deal with insurance, and make sure nothing else is going on.
Well, now one thing that he's been doing a lot of research on the internet is he's got a lot of signs of MS.
Well, then he does need to go to a neurologist if that's the case. I would say, because to be diagnosed, you want to go and actually, and MS is also exacerbated by stress.
Right.
So we're finding out all these things get so much worse during stress. And so,
Really?
Yes, no question. It is always flared during stress.
What are, I mean, he's having a lot of extremely back problems, and the pain radiates from, let's say, his tailbone all the way up to his neck, and just, in the past,
which could be
8 months, it's
neurological.
been getting up in his neck.
Yeah.
Right.
Also sounds like it possibly could be neurological. So you want to, and if he has some of the symptoms of MS, you want to at least have an MRI done of the brain. So that is something, and maybe he wants to work on getting insurance so he can go have the testing done. But
Well, see, that's the problem. He's out of work.
yeah.
Right now, and he was trying to get on disability, and he was turned down twice, and he just, like he said, he just wants to get help so he can go back to work. He don't want to get on
Well, maybe
disability.
tell him to come in and we can talk to him and see what we can do for him. And maybe if he had any past lab work, bring it in too. Y'all can come in together and bring your past lab work, and we'll look at it and we'll kind of go from there.
All right.
Well, let me ask you: Can you do blood work to see if he has MS?
MS,
Or that
No.
neurologist?
MS does not have a blood test.
Takes an imaging
It takes
study.
imaging studies, and those are pretty expensive. So you can't tell that from lab work.
Do you have to have an MRI, or can you do a CAT scan?
Either one.
Either one, but they usually do MRIs when they're looking for the plaque in the brain. But either, I mean, any scan could actually sometimes show it.
Do you know of any foundations out there that could possibly help him in order to be able to get that MRI done?
Unfortunately, I don't. You can check some of the maybe charity places around and ask if they know of places, but we don't.
No, sure
We
don't.
really don't.
Are you familiar with the Bethel Clinic?
No.
No.
No. Okay.
All right.
Okay.
We got to go to
Well,
break.
We're going to
It's
have
a
to go to
pretty-
break, Ton.
Okay, well, thank you
Thank
so
you.
much
Thank you.
for the
All right.
information, and we'll come into your
Okay.
store and have
Okay.
a blessed
Okay,
day.
sounds good. Thank you.
Willie from Pascagoula, hang on. We'll be right back with you. We're going to take a quick break, and we'll be right back. And welcome back to our Monday morning live edition of Healthy Living South Mississippi. Live healthy, be healthy with Drs. Jim and Janine Fox of Doctors Nutrition in Gulfport. Our phone lines are 896-0713, 800-349-0713. Willie from Pascagoula is on the phone with us this morning. Good morning, Willie. You have a question for the doctors.
Yes, sir.
Go right ahead.
I urinate quite a bit. Lately, I've been going to urinating about over 20 times a day.
Oh, that's a lot.
You know, and sometimes I go, the tingle is there, but I can't go. You know, and I don't know what's wrong.
How old are you, Willie?
I'm 61, soon to be 62. A few
Okay.
months, I'll be 62.
Okay, all right. It sounds like, I mean, there's a possibility for that hypertrophy or benign hypertrophy or swelling of the prostate. There's always that possibility. You really need to get it checked
Yeah, 'cause
out.
it could also be bladder too. Have you been to the
yeah.
doctor at all for it?
No, I have a doctor appointment this morning at 11 o'clock.
Okay,
Oh,
good.
okay, good.
Because you do want to, you do want to go find out what it is, and they can do an exam and make sure that nothing else is going on. You want to rule out other things first, but
Right.
that prostate enlargement is definitely a possibility.
But that frequent urination.
But also, it can be a urinary tract infection. It
Could
can be
be
a kidney
diabetes.
infection. It can be diabetes. It can,
be a
there's
lot
so
of
many
things,
things
Willie.
it can be. So you definitely get that checked.
See, I went to the hospital the other night. They were doing so bad I couldn't go, and they just give me a few pills and
Yeah.
say that ought to have it, but I'm doing the same thing.
Okay. Yeah, you need to get that checked out. Be sure and go to that doctor's
Yeah, that's
appointment.
been going on. It's been going on for a while.
Yeah, after you
Yeah.
go and you have your exam, if you have any questions, just give us a call. We'll be happy to, see if we can help
Yeah.
you any. But first, go get examined and find out what's going on.
Exactly.
Yes, sir. Yes,
Okay.
ma'am. Thank
Okay,
you all very much.
Oh, thank
Thank
you.
you.
He brought up something really good there. A lot of people, you hear a lot of things. If you go to the bathroom, like if you get up so many different times during the night or whatever, there could be a problem. Is there a standard that we kind of should go by? Maybe something like that as to if if I get up to go to the bathroom in the middle of the night 5 times, is that a little excessive?
Yeah.
5 times is
5
probably
times
often.
is, yeah. Typically, I mean, it depends on how much fluid you drink late in the evening. Mm-hmm. I mean, if you kind of start curtailing your fluid intake, say 5, 6 o'clock, 7 o'clock, then, you've had time to process that and get most of it taken care of before you go to bed, then you shouldn't get up more than, say, about once, maybe twice,
Maybe
tops.
twice, yeah.
And if you're getting up more than that, yeah, okay, that's indicating something's going on there that needs to be checked out.
But like we just mentioned with him, is it can be other problems too. So you have
Right.
to rule out other problems it can be, especially with him going 20 times.
Yeah.
Diabetes can do that too. So you just got to see.
Right.
Ann from Ocean Springs is on the phone with a question concerning MS. Good morning, Ann. What's your question for the doctors?
Okay, my question is, I started having double vision, and I was off balance, running into walls and whatever. And I went to the eye doctor because I was due, and the eye doctor said he wanted to send me to a neurologist, ophthalmologist. I think that's right. And they found through an MRI that I have white abnormalities in my brain, and they call it white cloud tracking or something. And my doctor's assistant said I had the beginnings of MS,
Quite possible.
and then when I saw the doctor, he said, I don't think so. Only 1% of people with in their 60s do not get MS. So I'd only have 1% chance that I did. But the symptoms come and they go.
Actually, usually MS is diagnosed earlier, but you can't ever say never. And
Right.
with symptoms that come and go, MS does act that way. So
Yeah, I've had this double vision off and on for a long time, but it's just gotten more frequent.
and I always say, if you have difference, go get another opinion. I mean, go to
Oh, yeah.
That's what I'm thinking.
Yeah.
Well, what is this white cloud? I mean, it's white stuff in my brain it's showing.
I mean,
What
without
else could
seeing
it
the
be?
scans exactly, we can't tell you exactly, but there can be plaque in the brain.
I think that's
which
probably what they were
is
talking
probably
about,
what
yeah.
they're talking about, but without seeing it, it's hard for us to say for sure.
It
But
could be what in the brain?
plaque,
Plaque.
uh-huh,
Okay.
plaquing in the brain, which
Then that's
even
one of the signs of MS.
yes,
Yeah.
and that is one of the signs. It doesn't mean it has to be MS though. So I agree, it doesn't have to be MS just because you have that. But I would get a second opinion. I'd go to a different doctor and see what they think, and bring all the scans with you.
Exactly.
Yeah, I've been on a good run now for about 2.5 months this time, and now it's coming back day or two, and it's gone again. So I just don't know what to think, and it's kind of scary.
Oh,
But,
yeah.
I think you're right. I think maybe I should go. He's the only doctor that does that on the coast.
And you don't have to actually go to one
No.
that does both. You could go to just a neurologist. So I would probably
Just
just
a regular
neurologist. Yes.
Neurologist,
Okay.
right.
Yep. I would go to a regular neurologist and see what they thought.
Well, I thank you very much.
Okay. Thank you.
You're welcome.
Bye-bye.
Bye-bye. All right, 896-0713, 800-349-0713. If you have a question for the doctors this morning, we'll be back with our final segment here in just a moment and this week's special. And welcome back to our final segment of this morning's live edition of Healthy Living South Mississippi. Live healthy, be healthy with Drs. Jim and Janine Fox of Doctors Nutrition. They're open Monday through Friday from 10 to 5:30 on Cowan Road in Gulfport. Saturdays from 11 to 2. Doctors Jim and Janine are there Monday, Tuesdays, and Thursdays. Dr. Mace is there on Wednesdays and Fridays. So we started off supposedly talking about prostate problems this morning and had one call on that, and then it kind of went elsewhere. But what are some other things that men should be aware of when it comes to things like that?
Well, I mean, I think obviously, that the prostate, there's been a lot of, talk, over the past, say, 7-8 years about some of the things in the food supply. We mentioned, a little earlier about the plastics and the phthalates. And a lot of these things are endocrine disruptors which cause that dihydrotestosterone to increase. Even been some, controversy, if you will, about some of the hormones and so on that they use in dairy. So dairy is kind of implicated that, that can cause some of these problems with conventional dairy. That's why it's good to do the organic dairy if you're going to do dairy. And so, there's just an awful lot of things in the food supply, if you will, that cause a lot of issues in men's health.
Yep.
And we don't talk about it as much as maybe, say, the women do, but it's
And
there.
another
It's causing
thing they
problems.
found is trans fats.
Yeah,
now,
bad fats.
people will say all along, oh, well, fat makes the prostate worse. Not necessarily, because one of the best things you can do for the prostate is pumpkin seed oil, which is a fat.
Yeah.
But it depends on what kind of fat you have. The good fats are not necessarily bad, but the trans fats are really bad. So really the thing you want to look at, and probably is something that you can go by, especially if you have a prostate problem, is go to a real food diet. Eat real food, stop the packaged processed junk, because that's what has all these chemicals and trans fats and
and
all the stuff in it that you don't want.
And here's something about trans fats. The FDA says, well, you have to label trans fats. All right, big whoopee deal. Because they say, well, if it's got less than a half a gram, per serving, you don't have to label it. Okay, so it could be a half a gram per serving, and if there's 10 servings in a particular bag or package or whatever you pick up, you're getting a possibility of getting quite a bit of trans fats. And another thing, kind of key words to watch when you're looking at packaging. If it says hydrogenated or partially hydrogenated such and such an oil, stay away from it because it's got trans fats, because that's when they become trans fats, is when they start being hydrogenated and partially hydrogenated. So, and that's where you see in the junk food stuff.
And like we always say, it's better though to eat food that doesn't have any of that listed at all because it's real
Exactly.
food. So if you eat lean meat and fruits and vegetables and nuts and seeds and things like that, then you can
There you go.
actually, don't have to worry about it.
Right.
Now, also, eating pumpkin seeds. We mentioned pumpkin seed oil being good for the prostate, but eating pumpkin seeds is
And they are
something
a
that you
great
can
snack.
do. It is a great snack, and it's good overall health, and it's real high in zinc.
I believe y'all have those at the store.
yeah.
Oh, yeah.
I've eaten those.
Yep.
They're
We munch
really
on those things a lot.
Actually, very
Yep.
tasty.
They
Zinc
are.
has been shown very beneficial for the prostate. Some of the natural things that we use in prostate health. Now, saw palmetto, everybody's heard of that one. And really what we've seen is saw palmetto alone, if you have the enlargement, I don't think it does it. It
No.
really doesn't from what we've seen.
Seems to be a good preventative.
It does.
So if you want to take it as a preventative, but now once you become symptomatic, no, I think you're going to have a combination.
A combination, and we do have a combination. It happens to be this week's special.
Right.
So we'll talk about this week's special real quick. It's actually called Saw Palmetto Plus, and then we have another one called Saw Palmetto Ultimate. And it's really not the saw palmetto in them that we think works. It's the extra stuff.
It's a combination of other things, right.
It's the combination, right. And in the Saw Palmetto Plus, we probably use mostly for the BPH. If somebody has the enlargement, it seems to work the best. And it is a combination of the saw palmetto, but it has the pygeum, it has the pumpkin seed oil.
And pygeum's an African plum, and they've been used that medicinally for years and years and years. And then it's got the stinging nettle root, which is a good anti-inflammatory.
Which is also a really good one too. Now the SP Ultimate's a little bit different. It's actually put together more for prostate cancer prevention. We're not talking about treatment, we're talking about prevention. And it has a lot of the things like the turmeric and a lot of the anti-inflammatories and selenium, which has been shown to be so beneficial for the prostate. So it has a large combination of things in it, and the beta-cytosterols and all that for the prostate. So there's a lot of natural things that can help.
There really are.
Yeah.
And even some of the flower pollens and so on.
Well, you mentioned the word a while ago, hydrogenated.
Right.
What does that mean?
Well,
They add hydrogen to it.
Well, yeah, hydrogen. Well, we're talking about
Ask a silly question.
That's right. It's at a molecular level. Okay. When you take something, we have two things. When you look at these oils, they're either a cis or trans. It's how they refract light. And when we look at say a long chain fatty acid, and it's normally that cis configuration, our body knows what to do with that, and it handles it very nicely. You start throwing that trans in there, one of the molecules that should be on the right, so to speak, one of them starts popping up on the left over here. And now all of a sudden it becomes a totally different fat. And our body doesn't handle these things very well. They're very, there's been a lot of research on them over the years. That's why, they've cut them down and tried to cut them out. And again, because they cause problems. They cause inflammation. They cause a lot of, they're kind of an endocrine disruptor in and of themselves. So, there's a whole host of things or reasons why you don't want those things. It's got a lot of negative
There's
health
no
things.
doubt they've been shown to affect the prostate.
Oh, yeah. Big time.
So if you have any other questions, of course, you can go in and talk to the doctors this week.
Sure.
Yep.
And
Sure.
again, they're open Monday through Friday from 10 to 5:30, Saturdays 11 till 2. And the two of y'all are there on Mondays, Tuesdays, and Thursdays.
Right.
Dr. Mays is there. And anytime that you're in there, a great group of people. And the other wonderful thing about it is we stress this all the time. You don't need an appointment. You might have to wait a few minutes sometimes, especially on a Monday. First thing.
Monday mornings are
Monday
crazy.
morning,
Yeah,
first
kinda
thing,
crazy.
that gets kind of crazy.
Yeah.
But you don't need an appointment, and there's no charge for consultation.
Right.
Right.
And like we talked to the other people that called in, and like we said, bring your lab work in. We'll be happy to look at that for you and look at it more nutritionally.
Exactly.
And see perhaps that you might need some further lab work done. Because, when you go to the doctor, you get lab work for preventive type things.
Or very specific
More
things.
specific, yeah.
And
Yeah.
sometimes if you have a certain problem, we want to look at a little bit, like I said, adrenals are rarely checked. And that does cause a lot of problems in people.
All right. But anyway, next week, excuse me, we're going to start a series.
Yeah.
Yes.
A special series that's going to run for several weeks.
Yes.
So
It's
and next week's going to be on.
vitamins. It's going to be vitamins, minerals, amino acids, herbs. And so it's kind of like what we do. And we're going to go into detail about them and what things they can help.
All right. Well, thank you for joining us this morning. Hope you have a wonderful week. Remember, the show's all about living healthy and being healthy, our Monday morning live edition. So have a great day.